finally, we just want to wrap up our discussion on heart failure. So the last time we discussed heart failure, the pathophysiology, a bit of the anatomy, and we talked about drugs, right? And why we did that, our major concern were the cardiac glycosides. That cardiac glycosides have a positive inotropic effect, while they have both a negative inotropic effect and a negative bromotropic effect. So now, this is just here, I'm talking about the drug interactions as it pertains to cardiac glycosides. That diuretics is one of the drugs we give for most of these cardiovascular conditions. That when you combine a diuretics with a cardiac glycoside, a strong one at that, like furosemide or glutathione, what you tend to have is you have a lot of sodium that are lost. You have hypokalemia, which will lead to this erection. So this will lead to digitalis toxicity. So this leads to digitalis toxicity because you have too much of sodium loss, potassium loss, whereas there might be a high intensity of calcium. So you want to be careful in combining your diuretics with your cardiac glycoside. Then cortisone, they increase sodium loss, and also why they cause sodium retention. So in these cases too, you want to be careful with cortisone. Antacids will reduce absorption of most drugs, and in this case also, they will reduce the absorption of the cardiac glycoside. So you either want to give the drugs at separate interval, or you want to stagger the dosage out. Now, another drug class we could use to manage heart failure are what we call phosphodiesterase inhibitor. From the words, we found that this is an enzyme. So phosphodiesterase inhibitors, like we put two here, like amyrinone lactate and milrinone lactate. So what they tend to do is that these drugs here, they have a positive inotropic effect. So they have a positive inotropic effect. So they can be given for acute CHF, congestive heart failure, or when other drugs don't work, we can give a phosphodiesterase because of their positive inotropic effect. Right? So this drug work by inhibiting this enzyme. The enzyme is phosphodiesterase. That enzyme that's inhibited, they therefore will cause vasodilation. Then what else? They will increase the stroke volume. They also will increase cardiac output. They can be administered IV for between 2 to 3 days. That is basically for phosphodiesterase inhibitors like what? Amyrinone and milrinone. And they may cause severe dyspneas. That is when you overdose the drug. They may cause severe dyspneas. The other drugs that can be given are vasodilators, diuretics, ACE inhibitors, angiotensin 2 receptor blockers, beta blockers. Then we have nesiricide and Bidil. To talk about vasodilators, most of these drugs we talk about them when we discuss hypertension. The vasodilators can either dilate the vein or the artery. So if it dilates the vein, it will reduce preload, thereby reduce blood return to the heart. It will increase vasodilatation. It will also decrease oxygen demanded by the heart. So this will reduce oxygen and the demand on the heart. Then if they're the ones that dilate the arterioles or the artery, this one tends to improve renal blood flow. They reduce afterload. They will increase renal perfusion and also increase what? Fluid loss. So this is necessary to reduce the blood pressure and to help with the issues in heart failure. So ACE inhibitors also behave this way, like our vasodilators that are on the artery, and also our angiotensin 2 receptor blockers also behave this way. These two drug classes would behave like this, just like a vasodilator. And we have beta blockers. So not all beta blockers can be given for heart failure. The ones we can give are like metoprolol and kebilol, just some that. But generally, you won't give beta blockers for class 4 heart failure. Your beta blocker will block ANS impulse to the heart. So it has a negative inotropic effect, and negative bromotropic effect, but can still be used in some type of heart failure. And they also reduce renin release. They reduce renin release that will also affect water retention later on. We have this drug called nesulicide. Nesulicide as an extra nitrogen peptide hormone inhibits ADH. So once you need ADH, you know that what you're trying to do is what this will lead to what natriuresis, diuresis, and also vasodilatation. The last drug let's talk about are what we call BD or BD. BD is a convenient product. You have your adrenaline, which is what a vasodilator or apresolene. Then the other drug is isosulfide. This is a drug we use in the management of what angina. Right. So this drug is FDA approved for treating heart failure in blacks, African Americans, because we have blacks are more prone to they are more prone to heart failure than the whites. Like the rate is twice, at least twice what we see in white. So this drug works because this one will dilate the arteries, like that with this one, this. Then this one to ensure there is a constant supply of blood to the myocardium of the heart. So this is where we stop. Thank you very much.